Assalamu alaikum, the communication day. The scenario, Mr. Kamil Zaki, 35 years old, a pilot, was admitted to the hospital with a primary pneumothorax. This was treated conservatively and the lung re-expanded, and he is eager to go discharge and asked to speak for a doctor to go home. So your task to sit with him and address his concern. Dr. Osama, ready?
Okay, yes.
Yeah. Okay, the time is there. Here you go.
Okay.
Okay, hello. This is Dr. Abdurrahman, the doctor in the clinic today. Can you confirm that you are Mr. Kamil Zaki and your age is 35 years old?
Yes.
Okay, welcome, Mr. Kamil.
Thank you.
Yes, okay. So today we are here to discuss some issues regarding your health status and to address any concern that you might raise. But
Okay.
before, are you okay with that?
Yes.
Okay. So, Mr. Kamil, before we start discussing the issues regarding your health status, can you tell me to some extent that you know about your health status?
So I was told that I had a condition called pneumothorax, and they gave me some oxygen for that. And they told me that say that my lungs have re-expanded again, and that and I feel well. So I'd like to go since I have an important flight in just 24 hours.
So I appreciate your knowledge about your condition, and I'm so sorry for what happened to you, Mr. Zaki. Okay, so I believe that you said you have pneumothorax, and that was a primary pneumothorax, and it was treated, and you want to discharge home.
Yes.
So, Mr. Zaki, yes, you're okay now,
Yes.
and you can be discharged home. But regarding your other concern, I'm sorry that I don't have a good news for you. You said that you are working as a pilot, right?
Pilot,
I cannot hear
yes.
your voice.
Can you hear me now?
It's very far. You said
Yeah,
that
it's
you
better,
are a
Dr.
pilot
Osama.
and you have a flight in 24 hours, right?
Dr. Osama, can you please be closer to your mic because your sound is so far? I put the timer, Dr. Salim. Yes, waiting for Dr. Osama.
Oh, sorry.
Okay, Dr. Osama, we are waiting for you. Just check your connection.
Yeah. Sorry, it's just a bad connection. Can you hear me now?
Yeah, much clear. Yes, please. Go ahead.
So, what's that news you wanted to tell me, doctor?
Okay.
Hello?
Dr. Osama?
Yeah.
Okay.
Yes.
So you said that, Mr. Zaki, you said that you are working as a pilot and you have a flight in 24 hours. Is that right?
Yes.
Can you hear me?
Yes, I hear you. Yeah.
Okay.
I can hear you.
Yes. So I'm sorry to tell you that I believe that it's not possible for you to fly in 24 hours after this incident.
Right.
Okay. So have you know about pneumothorax, or you want me to explain more about that for you?
Explain, please.
So, in order to explain pneumothorax in the right way, I believe that if I draw for you, that will be better. You see, these are your lungs, and the area is surrounding the lungs called the pleura. When you have a pneumothorax, the air will be trapped inside this area, making some pressure over your lungs. So when you are flying in the air, that will subject you to the hazard of this happening again. Especially it was primary, that means there was no cause for it. So it could happen again in the air, and this could danger your life, and you might lose your life while you are in the air. That's why actually I'm so sorry to tell you that you might not be able to you might fly maybe in 2 or 3 weeks, but you might not be able to resume your job. I'm so sorry to tell
Have
you
to
that.
stop being pilot?
Yes, I'm
You
so
mean
sorry
I
to tell
have to
you that.
stop being pilot?
Yeah, I'm so sorry to tell you
But
that. Mm-hmm.
I am okay, doctor. And this, I didn't have much symptoms, you know. So came
Mm-hmm.
to the hospital because it's a bit of discomfort and short, but it wasn't that much, and they didn't give me the oxygen for a lot of time. So I think I'm okay. I think even if that happens to me, I am a very good pilot, so I can take care of myself.
Okay, Mr. Zaki. Yeah, I appreciate your concern, and I know that you are a good pilot, and this is not in your hands. This has happened. This has just happened for you because this is just you are unlucky. So, because it's a primary, as I told you, that means the word primary means it happened without an obvious cause. So that means it can happen again, and you are driving an airplane with full of other people, so it will danger your life and as well as the lives of other people. So according to the regulations, you will not be able to resume your job again, but don't worry. We are going to involve the occupational health department. They are going to sit with you and find another solution to this to the job problem, like allocating you in another type of job. But unfortunately, I'm so sorry to tell you that you will not be able to resume your job again. Is this clear for you now?
This is it, doctor. Yes,
Again, I'm so sorry for that.
this is clear.
So, okay, so can I ask you some questions regarding
Yes,
your social? Okay, so Mr. Zaki, do you smoke?
yes,
Hello.
yes. I smoke.
So, Mr. Zaki,
Small amount.
smoking now became very dangerous for your life because it's one of the causes of the primary pneumothorax. That's why I highly recommend for you to cut smoking. And if you have any trouble to do so, I can recommend you to the smoking cessation department. So, Mr. Zaki, do you drink much alcohol?
No,
Okay. So, Mr. Zaki, do you have any hobbies or like diving or swimming or something?
2 minutes left.
I do some scuba diving sometimes.
Mm-hmm. Okay, Mrs.
Yeah.
Zaki. Yeah, I'm so sorry. I have another bad news for you. So this scuba diving now should be prohibited in your case. You cannot resume doing this again because under the sea, it's the same as in the air. So this could happen again for you, and it's one of the triggers for this. And then this will endanger your life. I'm so sorry to tell you this again.
Okay. Okay.
Okay. So, Mr. Zaki, do you have any other concern for me?
No. No.
Okay. So, Mr. Zaki, can you just tell me outlines what did you get from our discussion today?
So that because of this pneumothorax,
Mm-hmm.
I'll not be able to resume my job, and
Mm-hmm.
I will be able to do scuba diving,
Mm-hmm.
and I can't go to flight before 3 weeks.
Yes, yes, that's right. That is right. I'm going also to give you some brochures and leaflets to explain for you to read about this more and to explain for you further about this situation. And I will give you the contact number of the hospital also in case you have any questions or any further concerns. Please do not hesitate to contact me. Finished?
Yeah, time's up.
Okay.
Thank you, Dr. Salma. Well done.
Thank you.
Why you're so stressed?
Because I don't used to, I'm not used to present.
No,
Actually,
it's
maybe this is first time in,
you did it great, really,
thank
without
you.
any
Yeah.
hesitancies.
Good.
So confident, and yes, it's a good way to start with this practice and performance. Let's hear Dr. Osama comment, then I will comment, okay?
Okay.
Yeah. Yeah, I think you did well. So it was actually the scenario came in Kenya in Diet 3 2023. And yeah, so they gave the details, and I think the good thing was they gave the guidelines. In I couldn't remember it, but they gave the guidelines in the scenario, so that the pilot when can he resume flying and everything. So yeah, I think that's the main thing. Asking about the hobby, and asking about the job, and just illustrate more about the job and smoking. I think you covered everything.
Thank you. Thank you.
I have only comment about the duration.
Mm-hmm.
It's not 3 weeks, it was 6 weeks. So remember this, okay?
Okay. I just read it in the NHS now before starting. But it's okay, no problem. Maybe this is old.
No, we share these guidelines before in the group, and we practice this scenario, by the way,
Yeah, please,
before.
can you just repost it for me? I will read it
Sure.
again.
I will reshare it in the group.
Again. Yeah.
It was
Thank you.
no, most welcome, Dr. Salma. Plus the introduction, you missed the point of expectation, which is very important in any scenario in the communication. So you can know one of the
Mhm.
concern from the expectation. For example,
Doctor, because he said, I just was with Dr. Hassam in one of his. I was thinking about expectation, but he said when the patient complete his summary with a question, that means this is the expectation. So don't go and ask him again. Like he said, because I have a flight next week
in
for
the 24 hours,
in
yes.
24 hours, yes, and I want to be discharged. So if I ask him, what is your expectations today? He will tell me again, because I want to be discharged because I have a flight in 24 hours. So this is his concern. This is his expectation. This is his idea.
Yeah.
So let us try to ask him now. If I ask you, Dr. Osama, after you said to me that, what is your expectation today? What would be your answer?
Yeah, I think you're right. I would say I need to go and catch my flight. So
My
maybe
friend,
that's it.
yes. Yeah.
Okay.
So
So
Dr. Hassam
yeah,
said, don't ask about the expectations if the patient complete his summary
yeah.
with
If he
a
give you
question.
a concern during explanation, yes. Okay.
Yes, yes.
I agree. Yes, maybe I didn't hear him well in the first because the sound was little low. Anyway, this is our introduction usually to ask for the background and if he has any concern or any expectation, he can share with me and I can address it. You give him twice like warning shot. I'm sorry, I have bad news, which is good. You have to give in this way since it is carrying two bad news, so you can use it as breaking bad news. But for the reallocation, why you will reallocate him? He can travel or he can fly again. This is also another point. You can tell him after the duration of banned from flying, you can resume your job back, right?
That I
Because
don't know.
you know he
That,
can, he can.
I was hesitated about that. I
Mm.
heard before that they will ban them forever because it's a primary one, not secondary. That's why I answered like this, but I was not sure actually.
No, no. He
Mhm.
can, after 6 weeks, he will be reassessed. And if it is clear from pneumothorax, he can travel again or he can fly again. Okay. And
Mhm.
if he
I think
has recurrent, what if he has recurrent? What you can do? This as a clinical judgment.
I think in this situation he will be banned from flying if recurrent.
No.
You are talking about his job or treatment?
Yes. The treatment and the job. Okay.
Yeah. If it is recurrent, then he will need active treatment like chest tube, something, right? I can't
No, if
remember the
recurrent,
guidelines.
blooredectomy,
Yeah.
blooredectomy. He can do
Blooredectomy,
blooredectomy.
yes.
And
Yes.
if he do so, he can travel back safely because no more
Uh-huh.
pleura, right?
Uh,
Take
yeah,
care. It
okay.
might be raised by the
Mm.
surrogate. If I do
Mhm.
this surgery, will I fly again? It would be like that.
Mhm.
Okay. The same for scuba diving. They
Okay.
can do it because no more pleura.
Okay, yeah.
okay.
Okay.
And just so scuba diving, he can do it again just to check, or
Yes. Go ahead.
the scuba diving. Uh, Scuba diving, is it banned forever without the surgery? He can do it at all, or he can do it after a while.
After a surgery. No, if he didn't do the surgery, it's not allowed. So the surgery
Okay,
only can let him do it. Yes.
okay. And I think it's just maybe one thing is just you have to tell the patient to inform his occupational health, right? In
His
that
company
case,
or his yes airlines regulation
employer,
or his airline company, not occupational. Not our occupational. Yes,
occupational health.
occupational
Mm,
in his company, not in how in our hospital.
yeah. Mm,
Okay, we are providing him
okay.
with the fitness paper if he can fly or no, but
Mhm.
not our occupational. They can do anything related to his job.
So
Okay, our
the company
occupational,
will do that.
yes, our occupational team for our staff.
Okay.
You got it
Yeah. Yeah.
for the medical staff, healthcare worker. But for any job, the company has their occupational team. They can do whatever suitable for the patient or
Mhm.
for they can for the surrogate or according to the scenario to the patient. I mean, okay,
Mm. Okay.
okay. Apart from this, Doctor Salma, you did great. I will send you a scenario.
Thank you.
You can, yeah, you will do it with Doctor Osama. Actually, we
And
did
please
this.
don't forget the the pilot and the pneumothorax. You said you have
Yes,
the
I will share
guidelines.
it.
Okay.
No problem.
Okay.
I will share it. Yes.
Okay.
Uh, the scenario, I will send it now to you. Then you can be a surrogate for him.
This Dr. Basim, this pilot, he need a certificate or not after this 6 weeks?
He will be reassessed again. 6 week, he will not be able to fly, and after 6 week, he will. I don't know. Someone wrote here 3 weeks, but we read it before. I mean, recently it was 6 week. I will share it again better to understand because I agree it was 6 week. I don't know who's written 3 weeks. He can share also with us any evidence. Dr. Ali.
You mean 6 weeks for the pilot and 3 weeks for
Yes.
other people?
It was
Yeah.
2 weeks for the passenger. 2 weeks.
Passenger, yeah.
Yeah, passenger 2 weeks. But
Okay.
for the pilot was 6 week.
6 weeks.
Maybe the one
Okay.
wrote 3 weeks. Maybe he meant the
Passenger.
passenger, Dr. Ibrahim.
السلام
But
عليكم.
most. وعليكم السلام ورحمة الله وبركاته.
أنا درستها من فترة أيام السكند بارت. كان مكتوب أنا كنت مشارك في الأون إكزامينيشن
أها.
إن هي 3 ويك في بريطانيا، لكن مع ذلك كل الفلايت كومبانيز في بريطانيا تشترط 6 ويكس، لكن هم في
Yes.
الرولز بتاعتهم 3 ويكس.
Okay.
لكن البايلوت ما عنديش خلفية والله.
Yeah, it's 6 week, Dr. Ibrahim. Someone, Dr. Ryan, share it again here. You can see it. Thank you, Dr. Ryan. So it's 6 week. After 6 week, okay. Thank you, Dr. Ryan. Send for surgery for pleurodectomy if recurrent only. Expectation idea is important. Yes, I agree. Okay, this is the scenario, Dr. Salma and
Okay.
Dr. Osama. Mr. John Smith, 35 years, took the paracetamol for toothache unintentionally. The drug level follow-up was just above the normal. The team decided to give him one more dose of N-acetylcysteine. Actually, it will take this dose 10 minutes. 10 hours. It will be given over 10 hours. He insists to go home over 10 hours. He's insisting to go home, so you can sit with him and address his concern. Clear, Dr. Osama?
Yes, thank you.
Yes.
So you will be surrogate, Dr. Salma. I will send you the point, what you will talk about.
Yeah,
And
please.
the WhatsApp, yes. Any question or concern related to the previous scenario? By the way, this scenario came 3 days back in Alexandria Center. They changed the word. It was before mistakenly taken the paracetamol. This time they changed it to unintentionally. So they are playing with the scenario's words. Take care of every sentence in the scenario. Don't assume the scenario the same. I saw it previously in a previous center. I mean, or I practiced this scenario with some mentors because they can change one word and this word might change the whole plan. Okay, take care of this while reading the scenario. Know every word and every sentence in the scenario.
So, Dr. Bassem, for confirmation, if the
Mm.
pilot have another attack of pneumothorax, he should not uh, uh, go for flight till he assessed by the agency related to his occupation. Yes?
If he had another attacks, he will
Yes.
be assessed by the chest surgery. You mean in the
For
hospital before
no,
going?
I mean for to become a pilot again or to making a flight again. He should assist first till return back to the job after the second attack.
Second attack means recurrent, right?
Yes.
So he need to be operated, surgery. I mean, bluridectomy.
Surgery directly, or he will be assessed in his agency.
No, 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 not by his agency. He should be assessed in the chest surgery. He has second attempt or sorry, second attacks of pneumothorax. Consider it as a recurrent one, so he should be operated. This is the policy. Any recurrent pneumothorax should be fixed, right? And the only operation or the only solution is bluridectomy.
Because I think before I know about this scenario about like that, he will assist by his agency for fitness for flight. If it is
And
recurrent more,
uh-huh, who will give him the fitness?
they have a special agency. They like group of doctors responsible for
Okay,
assessment, like occupational health in his.
okay. Let's start
I
from
don't know
the
the name,
beginning.
but it is has specific
It's
name.
like
Like
airline, yes, airline regulation or airline related to the company itself, right? Okay, let's
yes,
assume patient had the pneumothorax. He will be admitted, of course, to the hospital first, right? The second
yes,
time. Before he will discharge or he'll be discharged, they will give him a paper.
yes. He will be banned again for 6 weeks, like that. Then, after in his job, we will give letter to for assessment
I
of
guess
his
he will
risk.
not be fit to go back without the surgery. I think so. Because this is the
Mm.
second, and the second will be like recurrent.
Mhm.
Anyway, it didn't come like this. But for my opinion, I mean, if you want to say be safe, better to be reassessed again if you are
Yes,
fit
we can
for,
say like that,
yeah, but
but
not by
yes,
the agency, by
because
our
we will not
doctors.
decide about him about the surgery,
No, no, we are
not
the
the
one.
one decide.
How come we are the one?
Like we will advise, we will refer you to specific doctors aware of your condition, but you will not fly till this assessment.
Of course, but who will decide for surgery? Not the agents, right?
Not the agent, but not you, because you are not the
Okay, I am not the one.
specialist.
Okay,
Yes,
but the chest surgery one, or he will be the one for deciding for that.
or yes, or the pulmonology doctor, the chest
Okay,
doctor.
chest or
We
chest,
can
yeah.
say the chest doctor. Yes,
Okay, chest doctor, yes, because the surgery is not decision by the surgeon. The surgery after assessment by the pulmonology. You're right.
the
Yes.
pulmonologist.
Yeah,
Yes.
and the decision, the action will be done by the surgery. Yes, you're right.
Okay, so we can like
Second,
being like
depend on
that,
the
or the
scenario.
scenario will be clear to say what you will say. In my scenario, for example, they said he has a vision problem after stroke, and he's still after assessment by ophthalmologist, he's still not banned, still not cleared to drive. So it is very clear that they not clear him to drive.
Yes,
So I think the scenario would be clear because the communication, they didn't test you for information. Absolutely, they test you for communication.
yes, communication, but also clinical judgment, how you can take decision. By the way, the
They
rules
will
for
tell you the
driving.
clue. I think
Yes, yes,
they will
yes.
not.
I agree. I agree.
They
For
assume that we don't know the rules
of course,
in
in
their
what
country.
you
Yes.
you know you know what in which area they can leave you without decision in the area of flight, for example, of driving, because you are not the one concerned for that. But for clinical
Mm.
judgment, you can say I can tell you after assessment, but you can't say I will give you after 1 month or after 1 year, because you are not the one assigned for this. Okay, you got it.
Yes, yes.
So you can refer him better than saying duration. If you are not okay and you are not sure about this duration, you can refer him better. This is my opinion. Always, please don't give him a specific time or duration to be banned from. But if you are agree, you can tell it. If he insists to ask again, doctor, for how long, doctor, for how long, for how long, and you are sure, tell it. But if you are not sure, tell him, I will refer you or I will guide you to the guidelines or the company or whatever, the one responsible for giving you the decision. They will be in a better position to give you a clear decision about driving back or flying back.
Mm.
Okay, this is not if they want to test you in the clinical judgment in this point, they will need from you to say this. They will not need to give a specific time or duration, because if you give a specific time, this is not your
And
job.
even from the first attack, if it is spontaneous or primary, we will say to him, we will refer you to the chest doctor and he will follow up you
I
after
agree.
clearance to flight again. And you can take advice about the recurrence of this problem.
Yes, I agree for that. Yes, it's better and be safe by referring any patient you are not fully confirmed
Yes,
about.
especially if in the scenario they didn't mention the cause or mention it is primary or spontaneous.
Yes,
So he
better
should be
referred.
follow up
Better
in
referred.
chest
Yes.
clinic. Yes.
Yeah, better to be referred. And if you referred, by the way, you can get the mark. Also, the one who said that the duration correctly, he can get the mark. But if you
Mhm.
want to be safe and you don't know the duration, refer him, let them decide for how long. But you know, some surrogates are very stupid. They want from you to say the duration.
Yes, I know.
Yeah,
I have
really.
one like that.
Yes. If
Yeah.
he's not well trained, maybe this is first time to be surrogate in his life. And he will be like this.
I may be, and they stress you also to say something wrong.
Yes,
So if you don't
maybe
know,
an instructor
don't
also.
say yes, don't say anything because they will return back the concern many times just to test you that you will not say anything you don't know. They
Exactly.
stress you also. Yes.
Yes, exactly. Yes. Okay. Thank you, Dr. Aish.
Welcome. Thank you too.
Okay, anyone? Dr. Osama ready?
Yes.
Yes.
Okay. Someone, Dr. Abu Salam, I entered the exam on 13 February. I will share my experience. Thank you so much. Waiting for you after this scenario. Excited to know. Okay. Just give us a couple of minutes if it's okay for you. Okay. Let's start the scenario. Are you ready? Timer is here. Here you go.
Yes. Hello, is this are you Mr. John Smith, 35 years old?
Yes.
My name is Dr. Rosman. I'm one of the medical doctors. We are here today. I'm just here to speak to you about some issues related to your health. Is that okay?
Yes, doctor.
Okay. Let's start by you telling me what do you know about your condition and why you are admitted here.
Yes, doctor. So I came here in the dental clinic because I have some toothache, and they gave me the painkiller paracetamol, and then they said that they give me they gave me a large amount and for treatment of this thing. So they treat me, and I am okay now.
Okay. And do you know why you were admitted here to the hospital?
Yes, because of this, because of what happened to me, because they gave me the treatment, and I took the treatment in the home, and they said the amount is too much. So they admit me to give me treatment for this condition, and I'm feeling okay now.
Yeah. So I see. So what happened? It's just as you said, you took a high dose of the painkiller. Unfortunately, this painkiller might, at high doses, might be dangerous to the some of your organs. One of them called the liver, and this could might endanger your life. That's why we kept you to give you some treatment, so and to monitor the drug level. Unfortunately, it showed that your drug level is quite high at a level that might be dangerous to your liver. That's why we need you to stay to have the antidote or the treatment so that this medication doesn't cause you any issues. Can you understand me?
No, doctor, uh, because you are telling me that they want to give me treatment again. They already give me the treatment, and I'm feeling well. And doctor, I have work. I have to go back to my work, so I cannot take treatment again for nothing.
Mm. So sorry for that. Go. It's is work, and I can give you a sick leave because when we repeated the blood, it's just that drug level was still that medication, the painkiller level was still high. So that's why to give you the treatment again. The treatment might take some time, and regarding the work, I can give you a note. I can write them a note to tell them that you needed to stay in the hospital and you needed this treatment
Yeah,
because
doctor,
it's
I
very
appreciate that, and thank you for the sick leave. But again, I cannot stay. I have some private things. I cannot stay in the hospital.
mm, really so sorry to hear that. But would you be able? Is it anything that I can help you with?
No, doctor. I want to go home because it's the birthday of my son. And I cannot be in the hospital while I am okay. And my son is still small. He will not understand why his father is not with him.
I'm really so sorry for that, Mr. Smith. I don't want you to go from the hospital well and have to go again. That's why I want you to take that medication. I highly appreciate your concern, but it's just well for safety to take this medication. Uh, we will. I understand that it's just it's very important to your health that and you need you to healthy. So that's why I want you to stay for the meeting.
So,
Would that be
doctor,
okay?
what can I do for this in this situation? I need to be present in my son's birthday. I need to be present. He's waiting for that for the whole year.
Hello, hello.
Yes, I can hear you.
Yeah. Mm. I'm really sorry, Mr. Smith. It's just your life. Your life and your health is very precious to us. That's why we we want you to take this medication. It's just you understand that there is high risks. It's just you might lose your liver if you don't take the treatment.
Okay. Okay, doctor.
So you will stay?
Yes, doctor.
Mm. Um, okay. So I'm so sorry to ruin your plans, but it's just we highly value your health and your well-being, and that's why we wanted you to stay. We will give you the treatment, and if there is anything we can help, we maybe arrange for you to have. If you want to have a video call to your son or anything, we can help with that.
Yeah, that would be very, very nice. But can you tell me, doctor, for how long are you going to keep me in the hospital?
It might be so the medication, it might be over 10 hours, and we will
Okay.
repeat the level again just to check that the level is low, and then we can if everything is okay, you can go home then.
Okay. Okay, doctor, thank you.
So can you just can you summarize what you understood from our conversation, if that's okay for you?
2 minutes left.
So because of this problem of the overdose of the painkiller, you decided to keep me in the hospital and to just, regardless of my very important life issues, and unfortunately, I will not be there for my son's birthday, and he's my only son. So, and you are suggesting for me to be there in like a video call. Okay, you are going to give me some medication and you are going to monitor me.
Yeah, yeah. And just we might give you once you are we might give you an alternative painkiller, very small dose, and we will specify the dose for you once. Do you have any other concern?
No.
Okay, okay, okay. So yeah, we will, as I told you, we will give you the medication to treat to treat you, and hopefully we repeat the level once it's we are happy about the level, and we are happy that you are safe. We can send you home. Um, we can send you home. Is that okay?
Okay,
Thank you.
thank you.
Okay, almost time is up. Thank you, Dr. Osama and Dr. Salma. You can comment now if you have comments.
Okay, so I think introduction and everything was good. I don't remember if he asked me about the expectations. I don't remember. Did you ask me, Dr. Osama?
No, I didn't ask you.
Because intentionally, I told you that I tried not to tell you my concern. I just told you the scenario that I took the paracetamol and admitted like this, but I did not talk about anything in my mind. But you did not ask me about the expectations. Let us assume that if you ask me about the expectations or the idea or anything, I will tell you that, yeah, I am okay now and I want to be discharged. Then in the scenario also, I gave you something just I came to learn, that there is something called nonverbal concern. The patient is not convinced, but you don't need to say anything apart from the sympathy and empathy. Let me just clarify this for you. The patient in the end, he is answering very unhappy. Okay. And when you ask the patient to summarize, he told you, you are forbidding me from going to the birthday of my son, and he's my only son. But okay, because you want to give me some treatment. So he looks frustrated or unhappy. You just need to do one very simple thing. It seems that Mr. John, it seems that you are unhappy. Yes, your son's birthday is very important for you, and your son is very precious for you. But your health is more precious, and I want you to be healthy to witness all his next birthdays in his life. Just sympathy and empathy will make the patient more happy. And this is my opinion. Correct me if I am wrong. Okay, and social. In the end, I don't
Yes.
know if it is important to ask social, if
Yeah, it's
anybody
important.
can share.
Yes.
Yeah, just few questions about the social would be perfect.
Yes, I agree. And red flags also in this scenario is very important. Safety netting at the end.
Safety netting, yes, safety
Yeah.
netting.
Yeah. What if he go home and you didn't give him any instruction about what might happen if he already left without finishing this dose? Because he's still and disagree to stay, right?
Mm-hmm.
So if he insists and in this scenario was insisting, what do you think the option will be before safety netting, Dr. Osama?
Uh, so it's just if he still, it might be just explaining the risk and what will
Yeah,
happen, and if he feel unwell to come back to the hospital.
exactly. Okay. Okay. What if he still insisting to go and you tried your best? Because all scenario might happen. You don't know what will happen in the
Oh,
end. If he insists to go without receiving the
yeah, I
last
think.
dose, and his capacity is okay, by the way, and you tried your best, what do you think? What offer you can give him?
So, so I mean, if he insists, explaining the risk and then telling him if he feels unwell, he needs to come back to the hospital, and or tell him that if he change his mind, we are happy to take him back. Is it?
No, this is before leaving, but what the
Mhm.
step before leaving?
Oh, he need to sign against medical
Yeah,
advice.
exactly. And to sit with the consultant.
Oh, sit with the consultant. Yeah.
Yeah. So I can arrange a meeting with my consultant. He's in a better position to explain to you. He can convince you to stay with us these hours. If you
Mhm.
are okay with that, I can arrange the meeting as soon as possible. No, doctor, I don't want to meet your consultant. Let me go, please. Okay, I explained to you
Okay.
the risk, and still, if you are insisting, so I can give you a paper called discharge me against medical advice, and you can read it carefully. And before leaving, you have to sign this paper, or I need from you to sign this paper because we already advise you to stay. But it's your right. You can go. This is your right to decide either to stay or to go. Of course, this scenario will be written as no suicidal attempt at all. But if they wrote for you anything related to suicide, you cannot leave him go. Okay, be sure about the suicide attempt or thoughts. If it's not written, you have to trust the scenario and you can let him go. You can let him go home. But if any suicide attempt or any suicide thoughts written like he took it with the alcohol, he took it while he's alone, he closed the door, any word from this risky behavior written, no doubt you have to detain him, but don't say I will detain. No, you can say it's to him. I will refer you to the mental doctor or to the specialized team to sit with you and to assess if
Yes,
you
to
can
see
go
his
home
health.
or no. Okay, but not in this scenario. This scenario is clear, no any suicidal thoughts, unintentionally or mistakenly, both are similar. Clear?
Mm, Okay. Okay. Thank you.
Yeah, most welcome, Dr. Osama. Thank you, Dr. Salma. I think this is the
Welcome.
scenario. Anyone has any doubt about this scenario, please raise it, or he can write or share it. Take care again about intentionally or mistakenly, but I think both will be similar in the practice. You can convince him to stay, especially the level just above the normal. And the last dose of anastasia will take 10 hours. He can be receive this dose, and after 10 hours, as Dr. Osama said, we can repeat the level. If the level is okay, I will let you go home. And I think if he insists to go after this 10 hours, you can offer or you can suggest this solution. Okay, we will let you go home after checking the result of your liver and your medication or the drug level. And if we have any new result, we can call you to come back. At the same time, offer him some red flag about anything might happen at home as a delayed effect. Please, if you feel dizzy or if you feel sick or throwing up or tummy discomfort or change of your eye color, change of your water work color or amount, please don't hesitate to come immediately to our emergency and let us know. Okay? Any scenario you feel the patient will go without finishing or completing his course of medication, you can give him the safety netting before leaving the hospital. I hope it's clear. Send
Yes.
to the consultant, yes. Okay, Dr. Ibrahim, you can say I will arrange meeting with my yes, exactly. This is the best way if you give up with the patient or surrogate. He's insisting after 3 times trial of convincing, still insisting. Yes, he has the right to leave, but please let me arrange with the meeting with my consultant. If he still angry and doesn't want to stay for even the meeting with the consultant, I'm afraid to say there is a form called DAMA form. It's important to sign it, and after that, we can let you go home. But please, if you feel any of this, tell him about the red flags or the safety netting, okay? He will ask to go home and come back only to take the medication. Are you going to let him do so? No, if he will go, the only occasion you can let him go if he receive and finish the dose of N-acetylcysteine, because this is what is written in the scenario. He will finish the dose of N-acetylcysteine after 10 hours, but he will go and he will come back to take the medication. He might not come.
If
Unsafe to
he
let
said
him.
that, I'm sorry to interrupt. If he
Yeah.
said that and he insisted for that, I think
Mhm.
you should inform him. He should again. I will arrange meeting with the consultant to decide upon that. And if you insisted, you have to also sign this DAMA, and then you can go and come back and make sure that we are going to take care of you. But uh, then safety netting. But if
Yes.
anything happened to you, please come back as soon as
Yes.
possible in the
Yes.
hospital.
Exactly. Especially if he insists. But if you could convince him, please don't let him go. He should finish this dose before leaving the hospital by any way. Okay. Of course,
Okay.
not by force, but as a
Yeah. Okay.
convince. Yeah, as a
Okay.
convince. Yeah, I tried and he is still insisting. Okay, this is you're right, and this is against your health. And you, again, as Dr. Osama said, your health is precious to us. It's precious also to your beloved person in the family, like your son, your wife, or whosoever he wants to go for him. The work issue already addressed. Well, yes, we can give you sick leave, or we can arrange a Zoom meeting for your job to communicate with your colleague to finish your job or your task at your job. But it's important for us to stay here because we are caring about your health. I hope it's clear for all now.
Yes.
Yes, thank you, Dr. Selma and Dr. Osama. Now we
Thank you.
can,
Sorry.
yeah, most welcome, most welcome. Now we can hear Dr. A. I don't know what the full name for you, Dr. A. Boo. Please, if you are here, you can share us your
Dr.
experience.
Basim. Yes,
Yes,
good morning. Me,
welcome.
Dr. Ahmed. Yes, how are you?
Fine, alhamdulillah.
Yeah. Alhamdulillah, I finished the exam and please pray for us.
Hopefully, inshallah, you'll
Yes,
pass.
inshallah.
I mean, inshallah, all of us.
Yes, I sit in Kuwait Center.
Wait. Yes.
Yes, yes. Johar Hospital, the
Mhm,
first Kurusi.
mhm,
The first station I started to visit was communication. Also, it's about DAM, discharge against medical advice. The
mhm,
scenario of a patient presented with hematemesis, and she
mhm,
done for her upper GI endoscopy, found to have esophagitis and gastritis. She has severe shoulder pain. She used NSAID for a long time. And now the second day after the event of hematemesis, and um, because in the scenarios I mentioned, because of like attempts to collect lab for her, the patient become angry and she want to go down, failed attempts. And inside, she give you another concern that she has her kids alone in the home, and the crowdiness of the wards are like that. But the surrogate, she's from the start. When I asked her about expectation, she give me around 5%. One side, I couldn't even. I want to take my pen to write anything. I found nothing.
You will regret asking this question. Oh my God, why I asked this
Become why?
expectation?
Yeah, exactly. So but when I just take the breeze, I think she, uh, because my colleague sit for the exam, he said now the trend is they didn't let you to explain more. They just one by one. So don't worry about your explanation. The most important thing to address the concerns. And by the way, when I follow this, uh, already you will fill all the steps, because she will, but maybe in a randomized way. You get my point? Yeah, yeah.
Yes,
She
yes.
will ask you about smoking. In the second, yeah, I
Yes,
mean
they
the
want you
social
to
will
fill
touch.
this
Yeah,
areas
exactly,
by her
exactly,
questions, not by
yeah,
your
yeah, exactly,
way.
yeah,
Yeah.
exactly, exactly. When I found that, I start to explain, and if I remember this, one of the concern I said to her, and as you asked, if I didn't remember, I will speak about a lot of points, and I asked her, I hope I address your concern. She said okay, but I feel she was convinced. Then I do recap and ask her, you will stay? She said yes. Okay, tell me. She said you told me about the seriousness and like that, and like, for the problems we will solve all of them. The social worker is there, and but when I asked her about recap at the last minute, she told me you will not let the junior staff to puncture me more. I told her thank you, but at this point, I will speak to the head
Let-
nurse, but
Yeah.
it is not about junior staff. It's about just the collection for your base of interest and like that. Because I feel that she told something which I didn't tell her about. I told her
Uh-huh.
just or raise the point of junior staff again. Uh, then I went to clinical. I don't know clinical for the station of the system, the cardiovascular like that. I need to tell about, or just about the spoke
No, it's okay.
about
If you want to, oh,
communication.
yeah, yeah, mention all. It's okay.
Okay, okay. The station was abdomen renal transplant. It was okay, good, but I didn't find the scar. I feel the mass, but I didn't find the scar. Patient has fistula, two fistula, one functioning, one non-functioning. A lot of scar in his neck, in two sides. And by the way, just I hope if all the colleagues to look at the left and right side of the neck, okay,
Yes.
because
Yes.
a lot of scars in the left side was in the left side.
Yes.
The I feel a mass in the maybe it's up in the right iliac fossa, but I didn't find any scar. When they told me 1 minute left, at that time the patient was sitting, so I just act like feel for lymph nodes, and I escape auscultation because I became hesitated. Is it in the right iliac fossa? Maybe this is polycystic. I do palpation again when I become confirm this is in the it is not it is mostly renal transplant. I look for the scar, no scar, but the patient has a lot of striae, like large striae, black in color, and a lot of hyperpigmentation. They told me your time finished. Present your case. I present advanced stage renal disease or like that. I look to the examiner. mm, I
Wasn't
feel they
satisfied.
are unsatisfied. So I told him,
Yes.
to be honest, I didn't find the scar.
Mm.
He told me, okay, what it could be. I told him, this mostly transplanted kidney, but one of them become like angry, and the other start to laugh. Told me how they boost this kidney. I told him maybe I missed the scar. This mostly. He told okay, and he discussed the case like that. One of the colleagues told me the scar is small and it is near to the striae. Unless you concentrate more, you will not find. And the
Oh my
patient
God.
has a lax abdomen.
Oh my
So,
God.
uh, but I told them I didn't find it, but mostly I missed it. This is a renal transplant. They told me, "Are you sure?" I told, "Yes, I'm sure." And they discussed the case like the management
Um,
plan and everything.
yeah.
Okay. The other station about consultation. Outside, patient has difficulty of breathing, 38 years old, for 2 weeks. The history from surrogate, and the patient sitting in a bed. Okay, the surrogate give me shortness of breath, and because I become occupied from outside this BE, I asked about all the risk factor for BE, all of them, nothing's there.
Mm.
Okay, at that time I told her, I want to examine the patient and ask more questions because I feel I didn't catch when
Yeah.
I
Something
start
wrong.
to when I look to the face of the patient, she has Graves' eye disease,
Oh my
clear.
God.
Okay, okay. At that time, I redirect the the history toward the thyroid. And by the way, because I'm occupied, when I revise myself, the candidate from the start, she told me she lost her weight, 2 kilograms of weight in last
Mm.
week, in last months, and she told me she told me I have menorrhagia. So this, but when I see the patient, I become concentrate on this hyperthyroid. They want the diagnosis of uh, thyroid heart disease. Okay, and I address the concern in the last minute of the because I have a lot, thyroid history is long history and
Yeah,
the
yeah, yeah.
complication and like
Of
that, yeah.
course. Yes.
And I lost most of the time with BE. So after he finished the discussion, they was satisfied, but after finishing the discussion, they told me. She asked you why you told her you need to exclude BE. I told him this is acute shortness of breath. And like that, they start to discuss after they discuss congestive heart failure and thyroid and Graves' disease. Ask me about BE. Two questions and the time out. I went to the next station. The next station was also communication. The second scenario was about error, medical error. That patient diagnosed with the stroke, and after reviewed by the radiologist, it was found to have primary brain tumor. I think it is common
Yeah,
scenario.
common scenarios.
Yes, yes. But when I become happy because I will go in the rule of A. I start apologize. When I apologize, I told him, oh, we will activate certain process, and there is a team. When I start to speak, he become shouting on me, Doctor, what shall I do with your team or with your apology? Tell me what you will do for me. I told him, okay. Uh, I start to tell him outline of management. Again, I went there. Again, he shout on me, Doctor, tell me about the plan of management. Okay, at that time, about the rule of A, I told him about plan of management. He started to raise concern which are not in the scenario. He told me about the prognosis, about uh, he will come back. But I told him when the team sit with you, they will tell you about the prognosis and like that. But in the scenario mentioned that the brain surgery, the neurosurgery, it is operable tumor, but and the oncology team is involved. All I told him this. The good news is that the surgery can be done and the tumor can be removed, but the next step it depends on the type of it, and the team will sit with you to tell you about the outcome. Okay, everything go in a right way after that. Yeah, he become
But before
he calmed down.
before moving to the next station, let's take a lesson from here. Any medical error, although it's very easy scenario, the steps it will follow, but please try to finish the medical steps and action before the administrative. Yes, it will satisfy the patient and surrogate
Yes,
rather than
exactly,
mentioning
exactly.
protocols. And so the action will be 1, 2, 3. Then the other action we did to improve our quality is 1, 2, 3.
Yes, yes, yes,
Yes,
yes.
I agree. Okay, go
He's
ahead.
not he's not concerning on that at all. I told you
Exactly. Yeah, but you have to tell
twice
him
I
later.
start.
Yes.
Yes, yes. Even after that, the scenario went in a smooth way. So, by the way, we finished in around 6 minutes. At that time, all of us become silent. I start to recap in the plan of management again. A lot of time till now, the examiner didn't say 2 minutes left. I don't know what shall I do. So I asked him that, please, can you tell me about what we say in the management, so not to let him angry again. He started to recap from the start, but alhamdulillah, he didn't become angry again. And at that time, they told me 2 minutes left. I give him the leaflets and the websites and a lot of apology. After also 1 minute is still there.
Doctor,
After that,
you asked him to recap?
yeah, because we become silent.
Because
I
4
told
minutes
him, just
left.
tell me. Yeah, 4 minutes. You got my point. I know. I couldn't say to him recap, but I told him like in
Yeah, he
key
knows
point.
what to do.
Yes.
4 minutes left.
So
Yeah.
you want to trigger him to be angry again
But he
in
didn't,
order to fill
alhamdulillah.
No.
in order
Not
to
like
fill the
that.
time.
No. I to fill the time. Just you get my point. And because when I ask him this question, it is just I don't know what shall I do. Just I want to speak to him in air. You become tension. The examiner look at you, the patient look at you, other patients in the scene, all people in the room look
Yeah.
at me. What shall I do? I need to speak.
Under the spot, you are the only one.
Yeah. Then I move. I think, but the examiner was satisfied. By the way, in this station I look at their papers because nothing to be done. They give me satisfaction, both of them. So also messages like Dr. Basin told you, don't um, don't be follow your concern, follow the patient concern. Okay, because
Yes.
in the communication scenario, we have something already like format. We need to fill the format to the patient from our side. But the patient they are trained in a certain way. Just be relaxed, be flexible with them. One by one, you will finish the scenario. Okay.
Okay.
In this station, I saw my papers. I moved to the other patient. It was a patient clubbing, and he has own oxygen. The patient is idiopathic pulmonary fibrosis. Although from outside he's obese, he has a hyperinflated chest, but I think this is compensated emphysema only. And the crypts was very fine, but it was in the basis, idiopathic pulmonary fibrosis. The discussion went in this way. Okay, the hard station was the other consultation. The other consultation, the patient is 65 years old from outside. He presented with melena. Inside, surrogate, young, I think he's a doctor. He gave you history of melena for 2 days only. And the only thing that he's a smoker. When you ask him about past history, he gave you have any bleeding from other sides. He's trained to say that I have hematuria around 7 years ago, and he told you about all the story. And I went to the doctor. I diagnosed as a case of renal cell carcinoma, and I underwent surgery, and they give me radiotherapy, and everything now is good. Again, I come back, ask him about all the general symptoms, anything about NITS, nothing there. Then family history, he told me my daughter has iron deficiency anemia. Any risk factor about that? No. I told him I want to examine the patient, but I become my mind become occupied by maybe this hereditary hemorrhagic telangiectasia, because these 2 points. He has melena. He gave me family history of iron deficiency anemia, and he mentioned he has like hematuria, but it was explained by RCC. When I start to examine the patient, he has telangiectasia on his hands. I told him, this is skin, you didn't tell me about this. He told me, I know nothing about it. Okay, do you have any other bleeding than hematuria? He told me, yes, doctor, I have epistaxis before 4 years. Any given diagnosis? He said, no. Is it recur again? He said, yes. In the last 4 years, it maybe happened around 3 to 4 times. I examine the patient. He has another only around 2 telangiectasia in his hand, the right one, and one large one in the tongue. In the examination, nothing else apart of scar in his abdomen, and even it is not for RCC. It is in the right hypochondrial area, but large score extend to the epigastric area. I think I don't know what is it. I asked him about it. He said this for the previous surgery. So I deal with it like that.
It might be surgery for angiodysplasia in the bowel.
I asked him, this is scar. You did any surgery apart of the surgery for RCC? He said no. So maybe they assume this is a scar for the RCC. He said no. Okay. I assume it's like he said. I examined his nose, nothing there, everything. His heart, everything, nothing. But discussion was about, I don't know if it's right or wrong, but the telangiectasia is obvious. When I saw in the hand, it's obvious. No risk factor for chronic liver disease, and even this is not the site for the it's like spider nevi. And by the way, maybe this is the second time to see telangiectasia, but it is blanchable and like that. So he presents with melena. He has past history of epistaxis, family history of anemia, And these lesions, I put a diagnosis of hereditary hemorrhagic telangiectasia and differential diagnosis with his risk factor of smoking, maybe peptic ulcer disease, but could not explain all the picture. And he told me, doctor, is it cancer? I told him, regard my diagnosis, this HHT, it's not cancer, but cancer is one of the possibility we need to look for it. We need to rule it. We'll do the camera test and like that. But two of colleagues in the same carousel, they told me, yes, we deal like HHT. When I asked outside, they told me HHT in young, but it's in the differential. He's 65 years old, I like that.
Yeah, I think you have to put a cancer as differential because he has history of bleeding.
RCC, but Dr. Basim, uh, I dig deep in this point. He's just like about to say to me, doctor, because twice he said to me, I'm stable, I complete my follow-up, still I follow up, and nothing is there. And RCC, one of the cancer with meats, but could not explain melena for me.
No. I didn't mean renal cell carcinoma. I mean gastric or colon cancer colon.
Yeah, okay. I get okay. At this point, so I review all the signs of cancer. I told him, yes, the cancer is one of the possibility, but cancer cannot explain epistaxis. I mean gastric cancer, epistaxis, or this telangiectasia. And
No, it's not explained. Yes, but bleeding
yes,
the rectum or any melena.
yes. So yeah, I mentioned
Mm.
the differential
Good.
diagnosis.
Yes.
But after that, they asked me what is the differential diagnosis for hereditary hemorrhagic telangiectasia. I told them ataxia telangiectasia, but not in this age group. And also the patient didn't give any neurological symptoms.
Drug
And,
induced. I think drug
I told them all the cause of thrombocytopenia, bleeding disorder, but he has no any
exactly.
family history of bleeding disorder or anything.
Yes.
Okay, and then they discuss with me regarding the plan of management for upper giant bleeding and 2 or 3 questions about hereditary hemorrhagic telangiectasia. The station finished. The last station with cardiovascular and neurology. The neurology is a little bit good because it's spastic paraparesis.
Good. Straightforward.
Yes, although the patient or he gave confusing sensation. He just consume our time all because it's up to the knees. He mentioned sometimes he feeling this. Please doctor again touch. And by the way, the next station was the second carousel examining the same patient. The examiner told them ignore about sensation directly. Ignore about sensation. I think he's not well trained. Because in the exam he told me, even in the face he told me I couldn't feel. Doctor, again. But it's straightforward spastic paraparesis. They discuss about multiple sclerosis. The other one, this young patient, I don't know this station till now. All the doctors or the carousel, the 2 carousel, maybe 2 or 3, we gave the same diagnosis, but everyone gave different diagnosis. Patient has 4 scars in his chest. One mid-sternotomy scar, other lateral thoracotomy scar, one in the gastric area, and he has a cardiac device. It's infraclavicular scar. He's young patient. Okay, he has clubbing. Okay, and I hear clicking metallic sound. It was,
Mhm.
yeah, it was not clear, but I heard it. And two of my colleagues in the other courses, they told, yes, we hear. So they asked what it could be the cause. I told them I heard second heart sound is clicky metallic. For me, this is aortic valve replacement. Okay, how you can explain the clubbing? I told them maybe infective endocarditis. This patient, he has infective endocarditis, he has clubbing, and he develops the complications. They put for him aortic valve replacement. What other possibility? Correct congenital heart disease, maybe.
Yes, exactly.
Yeah. How you can explain this cardiac device? I told them maybe he developed heart block with aortic root abscess. So they didn't ask about specific management. Just they keep around differential diagnosis.
Yes, exactly.
Okay. It was difficult. Really, it was difficult case because congenital heart disease is not common in PSS. Corrected congenital heart disease, the common is like valve replacement or something. If we didn't find the answer for the question, if the patient have aortic valve replacement, okay, we get the case. If he didn't have this clinical metallic sound, we lost it. But for me, when they told me 1 minute left, by my ear, I focused to hear for the metallic sound. You know, Dr. Basim, they told me it's not allowed to do this. You can act just when you barbate for the apex or like that. But I feel I will miss the case unless I do like this. So I put my ear near to his chest. This may
But
touch the welfare, I'm not sure. But I hear the metallic sound. At that time, I know where to go.
yes, but the click you want to hear by your ears is the double click, right?
I know even Dr. Basim, you know, I with all of these scars, and I don't know where to go. I'm doing examination. A part of this clubbing, I found nothing, and this scars. Is it correct congenital heart disease? They will discuss with me. I'm not. This
By the
is not
way,
pure medical case.
it can be as two surgery mid sternotomy scar, younger age, and later on he had aortic replacement. Why not? The mid sternotomy scar might be two scars in one area, but it will be the last one will be the one clear. You got it?
Where
Okay,
was the
but
thoracotomy
yeah,
scar? Where the thoracotomy scar? Lateral
mid
or
mid sternotomy scar or lateral both.
lateral? Where exactly is the lateral thoracostomy? Is this in axilla or like
Not in the,
pneumonectomy?
no, like that one down for valvotomy for the mitral valve. So why I become focused with this? Because for me,
So not
maybe
like Blalock scar?
The look, yes.
no,
Good point,
Not
والله, Dr. Aish.
no,
Yes.
no.
It wasn't?
because clubbing is
No.
very specific
Yes. For
congenital.
congenital heart disease,
Yeah.
yes. Or
Yes,
subacute infective endocarditis.
Yes, also yes.
Yeah.
yes.
But it's hard
But
case really.
yeah, Dr. Asha, you know, because when we work in clinical courses, they told you don't go. The examiner will not put rare cases in the and don't give like odd diagnosis. They will discuss with you this and they will drive you
Exactly.
in the wrong
Yeah.
way.
Yes.
You
Yeah.
are the one
So come
driving
on.
the scenario. If you
Yes,
can drive by
yes,
yourself better than letting them drive, yes.
yes, exactly. So I told I become confused really. A part of this clubbing, I couldn't catch anything. I become focused with this. Just I put my ear.
Yes. And if you
But
get the finding,
I'm
this
afraid.
is the steps of
Yeah,
examination and get
yeah.
some finding. I think it
But
is good,
the,
يعني.
Yeah, but some tutors, they told you if you put your maybe touch your the welfare of the patient, but I don't know.
They didn't comment when you
No,
make your
no, no,
ears
no.
shift.
Even
Yeah.
I look at their face, they are not angry.
Because the case is hard, really. The
Yeah,
one can do
yeah,
anything
exactly,
to know what's wrong.
exactly,
Yeah.
exactly. Because yeah, uh,
Yeah.
this is my second trial in thesis.
Inshallah, you will
The th-
get
yeah,
good mark, even if you don't reach the diagnosis.
yeah,
The
inshallah,
diagnosis
Yeah,
because
it's not
is two
necessary.
marks,
Yes.
no, not
By the way,
a lot
I
of
want
yeah,
to.
yeah,
marks.
yeah,
Yeah.
yeah, exactly, exactly. Okay, my focus is at that during the exam on my skills. Why? Because in the first trial, I lost by one skill. So in one of the consultation, I think the patient give me two concerns. I asked first one, and then the time finished. The
Mhm.
You
examiner
mean
asked
you
me,
mean you mean it was the skills of concern, the one you failed early,
yes, yes,
right?
yes, yes. So
Yeah.
I become focused on
On
uh,
everything and every skill.
I
Yes.
yeah, yeah, not to lost another concern in any station.
Mm.
Okay, in the other stations, it was not difficult part of this scar I lost in the abdomen. And by the way, when the examiner who was angry and stand near to me, he put borderline in judgment. I saw him.
Mhm.
He put why when I say I couldn't find a scar, maybe I missed it. He put the point
Yeah.
in the
Mm.
borderline in
Mhm.
judgment. Okay,
Forget it. Forget it. Inshallah, you
so
can. Yeah.
I discussed the case like this. In last, just they asked me if this patient has aortic valve replacement, how you can how you can explain the clubbing. I told him infective endocarditis, maybe this uh, cyanotic congenital heart disease, teratology of Fallot
Yes.
or anything, and he said, okay, how we will treat this patient. Just outlines about follow up if he's symptomatic, asymptomatic, and the INR
Yes. Exactly.
and clinic. They didn't even go deep. Okay. Uh, Again, they ask about the scars or what it could be the reason for the gastric scar. What could be a lot of every scar they ask by one.
Mm. They like the
Um,
finding by inspection more than by auscultation. They like to pick up
yes,
it.
yes, 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 exactly. So this exam.
Yeah. Yeah. It's.
Thank
Yeah,
you for sharing that, دكتور. وإن شاء
Yes,
الله
thank you so much.
النجاح والتوفيق يا رب.
Yes,
inshallah,
we will
inshallah,
get me good news from you, inshallah,
Inshallah.
soon.
inshallah,
I think
inshallah.
you
You.
did
So
good.
great for us.
You will pass,
Yes.
inshallah.
You gain a
Inshallah,
lot of
inshallah.
dua.
Yeah, yeah, yeah.
Yeah, inshallah.
No,
Yeah, we'll pray for you to pass this exam this time,
inshallah,
inshallah.
inshallah, inshallah, inshallah.
Hopefully, all of us,
Inshallah,
inshallah. Thank you,
inshallah.
Dr. Ahmed, for your time and your
Thank you.
experience. Really, it's good. And by the way, you did great. It's not that much worried. So don't think or don't put stress on yourself more. Okay,
Inshallah, inshallah.
inshallah. Thank you, Dr. Ahmed.
Thank you. Thank you. I hope success for all of us.
Thank you. Okay, there is some comments for your practice. Did you palpate two masses on the right side? I think he said one mass only. Radiation
Yeah,
colitis
I
also.
I asked
Yes.
this question because he said he didn't find the scar. So why he was convinced that this is transplantation?
A transplanted kidney, yes.
Yeah.
Because okay, the
Yeah.
mass I
Mhm.
balbas the mass again. The mass is not in palatable and not in the renal angle. It was in the right left also.
Okay. Okay.
The abdomen was lax. The patient abdomen
Mhm.
was lax,
Mm.
and
Okay.
but I confirm that it is not. This is not. But also by the way, during that I judge with myself if this is
Mhm.
polycystic kidney disease. the patient will not bring a patient with two fistula and like that. You get my point? This mostly in the stage disease with renal transplant. So I
Okay.
become looking for the scar.
Okay.
And they told the other colleagues, they told me, yeah, the scar was small, not clear, but there was a scar.
Yeah, this is what we can learn from this. You have to focus even deep in the skin, remove the hair, try to expose the area more and more. Definitely there is a scar. If you feel a mass, definitely there is a scar. Yeah, I hope they can also consider your stress in this station and they can pass your hopes.
The chief one, I think he become satisfactory at this point because he laughed, not
Okay.
in a way that he's comfortable. I told him I barbed this mass, mostly this renal transplant. It's in the right iliac fossa, but
Mm-hmm.
maybe I missed the scar, but for sure this is a mass in the right iliac fossa with this fistulae and this
Yeah,
scars in the neck. These are renal replacement
yeah,
select.
yes. Hopefully they will respect it, inshallah. Okay, Dr. Ibrahim said radiation colitis. He mean radiation colitis as a differential. I think radiation colitis as a differential is very rare case to give as a differential of the blood or melena or upper GI bleeding or lower GI bleeding.
You know, he said just for 2 days, the melena, and the history of RTC is 7 years ago.
Yeah, so I don't think it's fitting the case. Heart lung transplant, why not? But supposed to have clamshell. Or you mean one lung, single lung with heart? I don't think they are doing one lung with the heart. I think double lung and the heart transplant. Hopefully, we'll wait for the result as well as for the feedback.
Yes,
And
but
reassure us,
you know,
inshallah. Yes.
I think they want the aortic valve replacement.
Yeah.
And the
This is
discussion
this is the
that's
most common. Exactly.
yes,
Don't give something is very rare.
yeah.
Aortic or mitral
Valve
valve
replacement.
replacement. This
I
is the
become sure
common.
I become sure this aortic valve replacement.
Yes,
So
exactly.
I mentioned in my diagnosis this patient of aortic valve replacement.
Yes,
Just,
exactly.
then he start to ask about the scars, about the clubbing, how you can explain
Yeah,
and like
this
that.
how they want to gain more marks by asking other questions. But the main diagnosis, you will get the mark for the diagnosis, hopefully. And by the way, the sure and the more common scenarios in the heart station or cardiac station, aortic and mitral valve replacement, aortic stenosis, mitral regurg, mitral stenosis less frequent, and aortic regurg and the list and the down list. So the common is common. The replacement, aortic and mitral, are very common, and the mitral regurg with aortic stenosis, or and another case, an aortic stenosis, because they have a very clear murmur. Aortic stenosis and mitral regurg, very clear murmur. I had the case in the second attempt with long scenario. It was aortic stenosis, apart from the cardiac case. So aortic stenosis as a case, it's very common. Okay, and the murmur also very clear. You can hear all the murmur everywhere in over the pericardium. Hopefully, inshallah, all of us will pass and finish this nightmares of paces. Inshallah. Any question before ending the scenario? Ending this session, sorry.
السلام عليكم.
وعليكم السلام ورحمة الله وبركاته.
جزاكم الله خير دكتور باسم وجزاك الله خير دكتور أحمد for sharing your practice وإن شاء الله موفق.
آمين يا رب.
Just I have
آمين.
one question.
Yeah. Yes.
I have one question. You said in the communication,
Yes.
the stroke raise 5 concerns. In this situation, do I need to write the concerns and to answer one by one, or can I call the patient? I said, okay, Mr. Mention his name and then said, it's okay, now here I'm for you, and I will answer your concern one by one.
Yes, exactly like this.
وأجاوب عليه ولكن
Yes.
والخمسة مع بعض.
No. If you can remember in order, yes, okay, do it. But if you don't remember, tell him I answer how many concern of yours and let me know if you have others. Because never ever you can remember the whole concern with this stress. Difficult. So don't write, by the way. You will not write. If you take time to write, you will waste around 1 or maybe 2 minutes writing the concern. So the best way is,
Yes.
please, we will address your concern and please stop me anytime you have doubt. And let's start one by one. The first concern, for example, the flying. Okay, regarding the point of flying and address it. The second point for the surgery, yeah, regarding the second concern. If you remember so at least you remember two of them. But
مظبوط.
if you didn't remember, ask him. So may I know what the other concern? Tell me one by one, then I will, because they are memorizing them. This is their task in the exam.
Yes, Dr. Basim, you know, when I finished and asked her, do you have concern?
Yeah,
When the concerns I missed to answer, she raised again. I think
exactly. Yes, they
because
have.
I think she has no more than 5 concerns. She just told me all of them together because the scenario is calibrated.
Yes,
I don't
exactly.
think she will raise a lot of more than 5. And by the way, uh, mostly to around three concerns. So I
But
told you when I explain the points and the plan of management and start to convince her, it seems these are her concerns.
you
Because
know,
I remember she told me, doctor, I will not stay. I want not to stay here. You know, I have my kids alone in the home, and she told me these stupid nurses. They told you know, yeah.
yeah.
In
So I have
another
to
way,
address.
she
Yeah.
started to be.
So you address it one by one. And by the way, if the scenario will be done like this, I prefer to be like, because sometimes you are wasting time, and at the end they have a lot of concern, and you will not get the marks for the clinical judgment, because the clinical judgment also on the concern, as well as for the concern. You will miss a lot of marks because you didn't ask, you didn't address, and you didn't answer. The answer itself give you a mark for the clinical judgment. So I prefer if they will start by this way better than talking, and at the end you will find a lot of concerns. You got it? So if they will start giving a concern or a lot of concern, and I will address them one by one, and I will consume all the time explaining the concern, and the concern of course will be related to the scenario, why they raise this concern, because it's related to the scenario. It might be including the task. So it's better to finish the concern during the discussion rather than explaining something. Maybe it's not necessary in the scenario, and you will waste the concern and the clinical judgment points and
Exactly,
the
Dr.
marks.
Bas.
Yes, I
Yes,
agree.
exactly. Because yeah, when I finished and I want to ask her questions about social, the only thing that to ask her about, uh, do you have support? Only thing, or
Yeah.
with whom you are
Yes.
living. Only the smoking, alcohol, everything
Ex-
she raised as a concern.
Exactly. And see, the time here was okay, but for the medical error, you have a lot of time because no more consent. So
Yeah,
this is the difference between both scenarios. Inshallah, best of luck.
Thank you, Doctor.
Yeah, thank you, Dr. Ahmed, and best of luck, Dr. Ahmed. Hopefully, again, we'll pray for you, all of you, and for all of us. Any concern or any concern more? So thank you for enjoying this time with you. See you tomorrow, inshallah, with the clinical day. Thank you, everyone. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.